Hi, I'm Meshal Malik and you're watching Indus Special. Now, I've been talking to a lot of people from several generations over the past couple of weeks, those belonging to mine, my parents' generation, and my grandparents' generation. It all boils down to this one thing. What we're seeing right now is unprecedented. We don't know how to cope with the situation. That, of course, is causing a lot of mental stress and anxiety. On today's show, we talk about how individuals in their individual capacity as a community can help others themselves to deal with the situation, to cope with their mental stress, to cope with their anxiety, and what are some of the activities they can do. Joining us for this conversation is Dr. Carole Lieberman, who's a certified psychiatrist and Emmy-honored TV personality. She joins us from California. Also joining us is Adnaan Farooq, who's a health and wellness coach with over 20 years of experience. He joins us from Lahore. Thank you both for joining us and welcome to the show. Dr. Carole Lieberman, I'd like to begin with you. Now, as I stated, it's obvious that we're all going through various forms of mental stress during this time. But let's just try to understand why the state of mind, having a healthy state of mind, is so essential for our body to deal with diseases, for fighting diseases, and anything that comes our way. How important is mind over matter in a situation like this?
Your mind, your state of mind, your psychology is extremely, extremely important. It's not just people are focusing on, how far away to stay from each other and how long the coronavirus lasts and things like that. Really, if you worry too much about that, you are actually making yourself more vulnerable to catching coronavirus because stress lowers your immune system. And if your immune system is weak, then you are going to be more likely to catch the virus.
Unpack that for us a little more. How does our immune system get impacted by so much stress?
Well, stress actually, we are more familiar with some of the other things that stress causes, like high blood pressure or ulcers and things like that. So what stress does is it takes the part of your body that's the weakest and it attacks that. And the immune system is very vulnerable to any changes like that, hormonally and through different neurotransmitters and so on, things in your body, having common sense. The more we panic, the less we're able to really think about the important things that we need to do for ourselves.
Right. All right, stay with me on that point. Adnaan, I'd like to jump to you. Now, so many people are self-isolating, and that's what the majority should be doing right now. We know that by experts, by doctors' advice, everyone should be self-isolating. They should try to maintain that distance. But that also means that millions of people across the world are within the confines of their home and their regular routines are disrupted. That, of course, causes a lot of mental anxiety, but also our physical state changes. Take us through how we can remain physically healthy while staying in our homes.
There's a link between the body and the mind. So there's the state of the mind affects the body and vice versa. So, in addition to what the doctor said, I would add to this. I would say that, in addition to managing or practicing stress management strategies, one has to do things that not only boost immunity, but also keep us healthy. And that is, good nutrition. That is, some basic exercises that one can do at home, because once it's just the way we are as humans. Once when we exercise and when we eat good, we tend to feel good. And so
Okay, Adnaan, right. You're saying we need to eat good. Now take us through what a good diet should mean like. And I'm talking specifically about what it should be like during this time. I know that a lot of us follow a lot of fad diets around the year. We try to experiment with what works for weight loss and different things. But now our priority is strengthening our immune system. So tell us, what type of diet should we be following?
Yeah, and I couldn't say it any better, because there's weight loss, and most of the weight loss protocols will actually lower immunity. So this is a time where we need to focus on immunity, and sound and good nutrition is all about watching your nutrition in terms of the vitamins, that is essential. So I would have people go for all the food groups, so to speak. So we have the protein, which is, the meats, because they provide much needed protein, which the body doesn't manufacture. So I would have, people should start looking into meats as a consumption, not going overboard, but, adding a small portion of that. And then the basic vitamins, which are so essential, especially in terms of immunity. So I talk about zinc, I talk about vitamin C, I talk about vitamin D, and although supplementation is one aspect that we should look into, but there are also foods that we want to consider. So for example, for zinc-containing foods, we could go for nuts. They're an excellent source of zinc. And then there's whole eggs. Then there's meats, and then there's legumes like chickpeas, lentils. For vitamin C, everybody knows, citrus is a good source. Lemons, well, I mean, for me, it's a daily practice that I have lemon water when I wake up. So now's the time for everybody to wake up to the fact that these things exist for a reason. Then there's vitamin D from natural sources you get. Again, there's whole eggs, there's white beans, there's nuts. So as you can see, we're talking about a well-rounded nutrition. We're not cutting anything out. We're just looking at all the areas that are actually going to impact nutrition, and that's really going to help our immunity and actually help us feel better.
Dr. Lieberman, now let's go back to the fact that it's inevitable in the state to feel stressed out. There are many reasons for the anxiety that are being caused. And many of them, even having this conversation is a point of privilege to talk about how do we take care of our mental health when there are many people who can't even self-isolate. But let's try to talk about what can people do in their individual capacities. Now, one of the things that we are seeing right now is an influx of information, an influx of news from social media, from news channels, from WhatsApp groups. How is that impacting us? And do you think it's a good idea to limit this news?
Yes, absolutely. Really, there is still a lot unknown about coronavirus. And so if people focus on, and this really does come from, as you were saying, the news, sure. And so it's very stressful to try to figure out what's true and what's not true and what you should do. That's why the most important thing is to not worry about, how long we should isolate, whether we should isolate, all those kinds of things, but rather to focus on what we can do. We have control of ourselves. We don't have control about where the virus is in our environment, but we do have control of what we can do to make sure that we are the healthiest, so that if we come in contact with the virus, we are resilient, we can fight it off. And so, we were talking about nutrition. I mean, the basic kinds of things that our mommies and daddies taught us, first of all, washing your hands very frequently, and then eating the nutritious food, as we've been talking about, and exercise, as we've been talking about, and getting enough sleep. That's another one that's really important at this time, and taking supplements and so on. So you should really be focused more on you, because the media, most of it, and broadcast media and social media, that a lot of it, at least in the States, a lot of it is fear mongering. Makes us afraid, even if it doesn't mean to do that, but just by reporting on, well, now another person died and another, if you get obsessed with that, and you watch too many hours of television a day, or keep trying to find out how many people have died, where they are they close to you? I mean, it's a natural reaction, but that makes you scared and stressed out, and that really is doing yourself harm.
Right. Dr. Lieberman, on that point, I'd just like to put in, an opinion of mine. Of course, as you say, that there are numbers being reported constantly. And at this point, the media all over the world, well, we're hoping to try to state facts in order to bring about awareness of how crucial the situation is. But your point is very true there, that people who do not need to be constantly following the media, because they have the option to turn off the television, should try to limit their screen time, because it is causing this obsession of sorts with the death toll, with with what's happening. And unfortunately, there's not more than just self-isolating that a normal individual can do. But I do want to ask your opinion on a couple of questions that were put to me by various friends from the community who are talking about what is precisely and what is specifically causing them stress. And I'd like you to help them through this. Now, one of the main questions is that with the closing of borders and with travel bans, we have a disbursement of many family members all over the world. And those who are away from home are constantly worrying about what's happening back home. What do you think that those people can do in these uncertain times?
Telephones, isolating. It's really important to stay in touch, whether the people are in another country or, or you're isolated, everybody's in their own home. Isolation itself can cause stress. That's, it's important at least to get out and take a little walk and try not to, if you can do that without being too close to other people, because loneliness, for example, for those people who are isolated without a family and just by themselves, loneliness itself can cause problems. So it is important, whatever your situation, to try to stay in touch with whatever means, and now, of course, mostly it's cell phones and the internet.
Right. Adnaan, on that point of trying to go out for a walk, now we know that many communities are trying to discourage going to public parks and to many areas in which crowds can gather. But there are many people across the world who can go into their lawns, who can go outside for a bit. Let's talk about the importance of nature and fresh air in this regard.
Yeah, so you see the thing with stress and, bringing our stress down so we can, safeguard our immunity, I think it's really, really important, because we're talking social distancing here. So I think that really needs to be understood, because a lot of people tend to think that, staying indoors, it means just staying in that room, confinement. I mean, although that's, it makes sense, but, you can still go out, and as long as you're maintaining a certain distance from the other person, then I think it's also healthy for human beings to go out in nature. I mean, there are a lot of studies that talk about, the benefits of fresh air as you go out. So you really don't have to really go out, to the park necessarily, but you could just step outdoors and just, do some stroll and walk outside the house. And this is literally what I do. I mean, I've got a street which is not thoroughfare. So, I mean, I'm just walking and just enjoying a little bit of fresh air. And, it goes a long way.
Right. On that point, I just want to reiterate that we need to maintain community guidelines and rules, and whatever the government is stating, not crowding public places. Dr. Lieberman, going back to you, now we were talking about people who are away from family and the homesickness they might be feeling, the anxiety. There's also another case that was put out, and many people voiced this concern, was when you're stuck with the family in the house, there can be many anxieties that are induced by that alone. There can be certain dimensions, dysfunctionality within the household, or not getting along with family members. How do people cope with that situation while they have to be at home?
Yes, being at home with your family can either be fabulous, an opportunity, because so many times families don't get enough time to spend together. If one or both parents are working, you actually miss that time. But it can also be on the other extreme, the things that irritate you about other family members. Now, if you're with them 24/7, can be even more irritating. You have to, for one thing that you can do, is to make sure that each family member has some time where they can have alone space. Whether, depending upon, of course, how that is in your house, even if it means a quarter. But to have some time where you don't have to interact with the family each day. And then you can do things that you don't get a chance to do normally, like playing a lot of family games, to telling jokes to each other.
You're obviously telling us about the ways that family members can spend this time, but just getting to that point about when there is friction, very strong friction, what can people do to keep their stress levels down and also remain within the confines of their houses?
Well, I was mentioning about having some alone time for each family member so that you're not all the time in each other's face. What you really need to do is to look at this time as a kind of gift that, you're busy normally and now you can't do a lot of things that you would normally do. So
Right.
in that time, take that time to do things that you always wish you had time to do, like reading a book or watching a movie or something that normally every day you don't have time to do, right? Keeping a journal is good. And for kids, what's really important, this is, it's for parents not to pretend that the kids don't know or aren't scared about what's going on. You have to get your children to talk about how they're feeling and to draw pictures about how they're feeling so that they can express it and ask questions. And according to how old they are, you give them answers, that this is, you can tell them that this is like the cold or a regular flu. You don't have to go into very sophisticated.
There are measures that we can take, right? Right, Dr. Lieberman, stay with me. I want to also introduce another guest who's just joined us, Dr. Rashawn, who is the professor of sociology. He's also a Rubenstein Fellow with the Brookings Institution. He's joining us from Washington, D.C. Thank you so much for taking out the time, Dr. Ray, and hope you and your family is safe during what's happening. Now, Dr. Ray, you are, of course, a teacher. You deal with students. You know what other professors are going through. One of the main challenges that we're seeing in that dimension is remote learning. You, as someone in the position who has to teach people, knowing the teachers community, what do you think are some of the things that students and teachers alike need to keep in mind?
Yeah, so once again, thank you for having me on the show. My heart goes out to everyone who is dealing with this, from people who have been impacted and diagnosed, to families who have lost people, to also frontline healthcare workers like my wife, who are really trying to take care of people. As a professor at the University of Maryland in the Department of Sociology, I think there are several things that can be done, but I think there are 5 that are critical as professors have moved to online learning. I think first, we can provide PowerPoints and notes. Traditionally, I'm against this because I think that writing notes by hand and listening and reading is a way in which people retain information. But we are in a new era and we have to adjust. So the first thing is to make those materials available. Second is to record your lectures. You can do this live. Zoom has great technology. There are other platforms that have great technology. You can also record a YouTube video and then post that for your class. It's very important to allow students to be able to look at this information later. Their schedules have changed. You want to make sure that you adjust in those particular ways. Third, you can hold virtual office hours. The great thing about university settings is that for 15 or 16 weeks, we pretty much have the same schedule. So keep that same schedule. Have class at the same time. Have office hours at the same time. It will give students, as well as yourself as a professor, a sense of normalcy. Fourth, look, just convert to online quizzes and exams. Give a broader window by which to submit. Don't just say you only have 90 minutes. Instead, give a 24-hour period and allow people 90 minutes to finish the exam. A lot of the online portals that we have available as professors will really help with that. And then fifth, look, just shorten assignments. I mean, we can't necessarily do a lot of things with the research component right now, and so that simply is impossible. So make sure that you shorten those assignments and change that around.
Right. Dr. Lieberman, going back to you and talking about one thing that's coming up for students and people is that the lack of productivity and feeling that guilt of not doing enough when they're in their homes. What can you tell us about that?
Well, one thing that you can do to be productive and to be helpful for yourself and for others is to make a list of the people who you care about, your family, your friends, your coworkers. And every day, throughout the day, make sure that you contact as many of them as you can. Now, this not only helps yourself for having this human contact, but you'll feel good about yourself for also helping your neighbors, helping people who you care about. And that's so important to make you feel like this is what you can do. You can help other people to stay well through your contact.
Right. Dr. Lieberman, I just want to put in one more question that was put to me, was that the anxiety is causing many people to have panic attacks, anxiety attacks. How can they help themselves during times like those?
You know, it is particularly hard. This situation is particularly hard for people who have underlying psychological problems, you know, in addition to being stressed because of coronavirus. And if this is getting to be too much, you can mainly, if you're, you know, quarantined or isolated, mainly it's through contact with other people. It's also through meditating. It's also through playing calming music. Also, you can, you know, put on music, dance music, and get your whole family to dance with you. Things that you enjoy doing.
That's a good advice there. Adnaan, talking about the exercise domain of all of this, how many minutes or how many hours do you recommend for activity, and how can people remain active within the household?
There is no limit as such. I would really underscore the enjoyment factor, and that could mean different for different people. Some people could go on for 40 minutes, people who've been exercising, and then there's the other lot who's probably now are understanding the importance of exercise vis-a-vis immunity and so forth. So I'd say anywhere between 15 to 45 minutes daily is what's needed, because more than the duration, I believe consistency is what's important. So in other words, people who don't enjoy exercise, I mean, if you tell them to go like 45 minutes every day, that's going to be a bit much for them. So I'd loosen that range. I'd say whatever makes sense to you, that's what it is, because at the end of the day, our goal is very specific, and that is, you know, a bit of mobility, a bit of, you know, blood circulation, and that's about it. So, yeah, so it's a range, and it's different for different people.
Right. Dr. Ray, I want to get to an aspect. While we're isolated, there is this need of community support in different ways, virtual or in just helping out a neighbor. What do you think are some of the ways people can do that?
I think there are several ways. I think we can use technology like we're doing now. My family, because I have two young boys, an 8 and a 9-year-old, we schedule play dates with their friends. We just scheduled one this morning for a family in New York who is highly quarantined, who have very young children, and we're going to have a virtual play date, and my boys are going to have a dance party with them. It's just a way to connect and see people. I think that we also put a schedule together and say, who do we want to make sure we contact? We make sure we contact our older relatives. We make sure we contact our younger relatives. And then even within the household, I think it's a very, very important opportunity to further bond with your family. As we move through a very high-paced society, I think at times we lose focus in the fact of what's most important. And oftentimes those are family members. So take that opportunity to spend time with them. I also think from an educational standpoint, there are some things that universities can do to essentially alleviate some of the stress that professors, students are experiencing. First, you can stop trying to proceed as normal. Second, universities can move to a pass-fail. And then if students really feel like that they need that grade for another degree or something that they want to do, then they can get that actual grade. But some students might not necessarily want to do that. I think a lot of professors know that some students are fine with just getting a C, while other students make an 89 or a 90, and they're probably about to cry. So we want to make sure we have that flexibility there. And then third, universities need to roll back, and even employers need to roll back on the email overload. It's a lot of that happening. I think fourth, tenure clocks need to be reassessed. There are a lot of professors with small children. There are also people who have people, professors who are taking care of elderly people, taking care of other younger people and other siblings. We want to have flexibility there. So thinking about that clock matters. And then also, I really worry about the most vulnerable among us. At universities, those are adjunct professors, those are students who only have a place to stay when they're at college. And we need to be very amenable to that. So while a lot of us are in our households being quarantined, complaining about the fact that there are certain things we can't do, there are a lot of people who are out exposed, because if they're not out working, they don't make money and they don't have places to go. And we need to keep that in mind.
Right. Dr. Ray, I just want to put, thank you for that point there, stressing how important it is to keep in mind the dynamics and the unprecedented situation here. Dr. Lieberman, just putting one last question to you. In regards to the elderly, a lot of people are finding it difficult to communicate the gravity of the situation. What are some of the tips you could tell them about this scenario?
Well, you know, it's a fine line. Because on the one hand, yes, you don't want your parents or grandparents to do anything that exposes them, that makes them more likely to catch coronavirus. But on the other hand, you have to be careful that you don't want to overstress them, make them too worried, because a lot of times get everybody too frightened about this, so that they do things that not only we're talking about or lowering their immune system, but just so that they don't do things that are common sense. The basics that we talked about and that can't be stressed enough, the hand washing, the eating nutritious food, the taking supplement vitamins, getting enough sleep, getting enough exercise. Those are the things that everybody should be concentrating on, and you can make all of those things fun.
Right. Thank you for that point there, Dr. Carole Lieberman. Adnaan, just one last question, and in regard to the following that Dr. Lieberman talked about. For the elderly, how can we get them to stay healthy in terms of their movement and their diet?
First, allow me to, because we're talking about immunity, please allow me to talk a little bit about, just quickly about stress and, the interpersonal equation that is coming into play. I just want to, make a point here that, since we're in front of each other, and it makes all the more sense to have the basic knowledge to not make things worse between people, like siblings or husband or wife, so forth. I'd say, listening skills are absolutely critical at this point. We need to be able to understand each other's point, because if we are having trouble at home, and there's certainly trouble outside, we're just making things worse, because if there's relationship stress, then we're having, there's this problem indoors as well. So now is a good time to talk, think and maybe learn about listening skills, 1, and 2. Empathy is absolutely critical. We need to see things from the other person's perspective.
Definitely.
Yeah, so I mean, I should be able to see things from your angle and vice versa. And if we just learn the basics of relationships, I think it'll go a long way in helping maintaining healthy relationships. So that's just the point I wanted to say. And as far as back to your question, I think because we're dealing with restricted mobility, so to speak. I'm generalizing here because most of the elderly we cannot freely exercise.
Adnaan, just one point that you would we're running short on time. Just one point you think is essential for all age groups. Just one quick point.
Yeah, it's in terms of exercise, it's just assisted exercise, whatever we can do at home. It could be basic lower body exercise. You could hold on to a wall and do like really slow squats. So you could literally be sitting in a chair and doing grabbing a water bottle or 2 water bottles and doing some upper body exercise. Or you could even be doing assisted push-ups where you have your knees actually on the floor and you're trying to do some basic moves.
Right, Dr. Adnaan, I got you there. That's important to try to do what you can given the circumstances, but do keep healthy through your exercise, through trying to keep your mental health in check, helping those around you within your homes remotely. All these points were highlighted excellently by our guests here. Thank you so much, Dr. Carole Lieberman, for joining us from California, Adnaan Farooq for joining us from Lahore. We're going to go for a short break, but when we return, we talk about how we can help the most vulnerable in our communities. Stay with us. Welcome back to the show. Now, experts and medical experts all around the world are stressing more than anything that the most vulnerable during this pandemic are the elderly. Of course, that doesn't disregard the fact that every age group is vulnerable to disease and that they need to take precautions, but we need to be extra careful around the elderly. Now, around the world in several communities, there are different dynamics that families have with those who are above 60 in their families, their grandparents. We also see in communities that many elderly do not have fallback support. So on this segment, we're going to talk about what people in their individual capacities can do during a time like this. Joining us for this discussion is Valerio Bordonero, who's an analyst joining us from Rome. Also joining us is Mr. Rashawn, who's a professor of sociology at the University of Maryland, Rubenstein Fellow at the Brookings University. He joins us from Washington, D.C. Thank you both for joining us and welcome to the show. Dr. Ray, just one of the questions I want to begin with is the narrative we've been hearing from a lot of young people who have been disregarding the importance of staying at home. And they've been saying that this disease is for the elderly. Let's try to highlight why it's important to remember the value that our elders, that our elderly community plays in societies all around the world.
I think it's a few things, and this is such an important point. First, if individuals go off, like what's happening in the United States, and they go off for spring break, and then they come back home and they are quarantined, they are oftentimes going around their parents and grandparents, exposing the very people who we want to try to protect. And in that exposure, even though you might have a 21-year-old who may not get as sick as someone who is, say, 61, that 21-year-old can then pass the coronavirus to that 61-year-old. So we want to be very mindful of that. I think that dynamic is something that has eluded us. As universities have shut down, essentially, and then sent children away, they are going home to the very people who we want to protect. I think the second thing is there's recent information come out about more demographics on age. And one of the big things we're seeing is that people who are in the range of like 25 to 55 are some of individuals who are some of the most people to end up getting the virus. So maybe that doesn't necessarily mean impacting the mortality rate, but they are contracting the virus. And people who have underlying health conditions, at times, underlying health conditions that they don't even realize they have yet, can be susceptible to this. I think the third thing is we really don't know the long-term health ramifications of the coronavirus. There's a lot of evidence coming out of Asia, coming out of Europe about the impact that the coronavirus has on people's lungs. This is why in the United States, we are having a lot of controversy around getting different types of medical equipment in and sharing medical equipment. And so those types of things are key. I think those 3 points for younger people really, really need to hit home to make sure that we protect the people who we really care about.
Dr. Ray, just expanding on that, now needing to understand how vulnerable the elderly can be to this and how many young people can be carriers, also trying to remember and talk about why this population, the elderly population, is so essential for our culture and for our society at large. Can you just take us home on that point specifically, why we need to remember, why we need to protect them so much?
Yeah, that's a great question. I mean, depending on where we are around the world, kind of dictates how we value elderly people. And while there are some countries and some cultures who have a high value for the elderly, in the United States, for example, that hasn't necessarily been something that's happened. I mean, when I go to a local grocery store and I see a woman who is 75, 80 years old, ringing up my groceries, I mean, that just does something visceral to me. And, you know, as a person who has an elderly grandmother and other elderly relatives, it really brings this to heart in what we have to do to protect them. So I think part of what has to happen in certain countries is this gives us the ability to reset and actually place a value set on elderly people in a way that we haven't before. In the United States, this means really thinking about making sure that healthcare is provided. I think one big thing that's also happened during this pandemic, and Context Magazine Sociology for the Public, which I'm the co-editor with Fabio Rojas, we had a special call for practitioners, for professors, for researchers and scientists to submit opinion editorials. One of the big things that came back with that is that a lot of hospitals and elderly centers around the world are shutting down. This means they're not letting anyone come in. What this means is that you have some elderly people who have now been shut off from the main people who they depend on. They've also been shut off from having someone help make medical decisions for them. And I think for a lot of families, they are worried about what this means. We have a family relative right now who is in a senior center for retired veterans in the United States, and he contracted pneumonia. And when we think about that dynamic and the fact, something that we really, really need to change and alter and think about more acutely.
Right. Dr. Ray, that's an important point. I want to jump to Valerio. Valerio, now, of course, you're talking to us from the heart of Italy. You're talking to us at the epicenter of the outbreak in Europe. Take us through what measures are being taken to protect the elderly community, especially in a culture where there's a lot of intermingling of generations.
Well, actually, our volunteers are doing their best to provide as much as they can the grocery directly at home for the elders. But of course, there's never enough of these people who can volunteer for them, because in Italy, as in many other countries in Europe and in Japan especially, the median age is very high. This means that the biggest group of our population was born from the very last years of the 40s and during the 50s. Those baby boomers is the biggest group of our population. This means that vulnerable people are a lot of people in Italy. And it is very important that we found all the measures possible to safeguard this population that is more vulnerable. The point is that it's not that much about don't let them go out, but it's better to keep as many people as possible inside.
Right.
You were saying about
Valerio, I just want to put one specific question to you here. Sorry to interject, but I want to put this one specific question to you. I'm sure you talk to a lot of community members who have grandparents, and as Dr. Ray mentioned, that there is this need to distance yourself from them. How are they helping their grandparents emotionally cope during this time?
What we are seeing, it's great. You know, during the last 10 or 20 years, every government has tried its best to digitalize the society. Now it's coronavirus who is doing it. So our grandparents are using for the first time Skype or video calls, and this is the only way that we can shorten the distances through digitalization. Of course, there will be challenges as well. There's some part of the countries who are more remote and not well connected to the rest of the country, but the digitalization of services is something that we are doing greatly during these days, more than in previous 10 or 20 years.
Right. Valerio, just want to put another dynamic to you, something that we have here a lot, which is we live with our grandparents. There are family structures in which we have two families, two generations living within the same household. How can those households help to protect the elderly in this regard? Are there any tips, anything that the government in Italy and those that you feel like are working in similar situations, something that you could give us as a piece of advice?
There's nothing specific about that. This is not a very common case in Italy to have 3 generations living in the same unit. But of course, what we are listening so much is that the younger people are most probably the vector of the virus. So if you want to...
I think it's important to remember that we need to make sure that the elderly within our homes are protected, and the onus comes on those who are young, who could be, who are from the youth, who are from the younger generation. They don't go out, they don't become a carrier. Dr. Ray, community support, how essential is that in different ways for the elderly at this point in time, doing what you can for your elderly neighbor, for your grandparent? Just take us through how essential that is.
I mean, I think it's essential. So obviously, we don't necessarily want really anyone going out, but particularly people who are elderly. And so there are some things that people can do. Obviously, do a daily check-in, oftentimes multiple times a day. The second thing you can do is ask direct questions about food. Do you have food? Do you have some of the foods that you like? I mean, look, people know that elderly people and kids, when there's food in front of them that they don't like, they just oftentimes don't want to eat it. And so we want to be mindful of those particular things. With food deliveries really ramping up, you can send your elderly relatives food. You can send them food, and then you can tell them how to deal with the packaging, that they need to leave the packaging outside. They need to spray it down, take the food out, and then bring the food into their homes. So there are several things that can be done to make sure that they are eating, to make sure that they are being checked upon. If you don't have elderly relatives and say you live in a city, or even an urban area, you want to check on your neighbors. You want to say, do you have what you need? I'm running to the store. Can I bring you back anything? You know, you can also just simply put a care package there. And I think we really can't get behind or beside the fact that sometimes just telling someone that you care about them matters so much, helps their well-being, helps their mental and emotional health. So maybe doing a handwritten card, having your kids do a handwritten card to send to your neighbors, to put on their front door, to even do a handwritten card and showing it to your elderly relatives. As an example, yesterday was my kids' time to FaceTime with my mother. And we do the same thing with my wife's mother. And I was trying to get 30 minutes of work done during this time. And what I heard was my mom yelling out different animal noises. And my kids were running around trying to guess which animal that she was being in that moment. Those are the types of moments that people will remember. And as everyone is stressed out, from the elderly to kids, we can create some normalcy and use technology to do that.
Right. Thank you so much, Dr. Rashawn Ray, for highlighting how essential community support is at this time. Thank you, Mr. Valerio Bordonero, for joining us from Rome, talking about what's happening down there. Now, during times like this, we're trying to highlight how it's important and why it's important to prioritize your mental health and take care of those who are around you. Please stay safe, remain indoors, and do what you can to help those around you. That's all from Indus Special today. We'll see you again tomorrow with more stories. Till then, goodbye and take care.